Today we'll be walking through an overview of IBM's Smarter Process Accelerator for the healthcare industry and how it can help healthcare organizations to address some of their challenges. We'll briefly touch on the state of healthcare today and discuss why IBM has created Smarter Process Industry Accelerators. Then we'll describe and demonstrate the Smarter Process Accelerator for healthcare, and there's additional information that appears at the end of this presentation. Let's start by talking about the state of the healthcare industry today. There are a lot of changes occurring in an attempt to make improvements to healthcare. For example, the Affordable Care Act, or Obamacare, as it's commonly referred to. These changes add to a large set of challenges already faced by the healthcare industry. Hospitals may or may not have good medical equipment, but they're in the dark ages when it comes to use of IT technology. Doctors and nurses need to care for patients and keep up with the latest medical information. At the same time, they're faced with an ever-increasing set of rules to follow, added oversight, and more paperwork. Studies have shown that the healthcare industry is one of the least efficient industries in our economy today. Lean Six Sigma is being used by organizations to design improvements in business processes, but those processes remain largely manual. The efficiency of the healthcare industry could be improved significantly with better automation. Nearly every aspect of completing daily business is part of a process. It's how companies get work done, and so effective and efficient processes have a huge impact on shaping the performance of organizations. This is why smart companies are good at business process management. It's why IBM is excited to introduce Smarter Process Industry Accelerators. IBM Industry Accelerators provide flexibility and time to value. Our pre-built industry accelerators provide time to value by giving you a jumpstart to implement faster and while taking advantage of automation and industry-specific best practices. IBM Business Process Manager and Operational Decision Manager provide greater flexibility than vertical out-of-the-box solutions and are easy to tailor to meet specific needs. This gives healthcare organizations the ability to easily adapt to change. In addition, the IBM accelerators are available in the cloud, offering low startup costs and fast return on investment. And finally, our industry accelerators are mobile ready, so you can take your business to the next level, so you can stay one step ahead of the competition. So what is an industry accelerator? It's a code asset containing processes, rules, and data objects that target a specific industry use case. Accelerators demonstrate the capability and the value of IBM products with the goal of accelerating time to production. Accelerators are not complete end-to-end processes. They are a starter solution that is easily adapted to meet individual business needs. As a services asset, they're maintained and delivered by the IBM Smarter Process Center of Competency, or COC. You can extend our accelerators with mobile first and many other IBM as well as non-IBM products. The services aspect of the accelerator means that you get access to a vast array of deeply knowledgeable industry experts that will help you implement and customize your accelerator. Our accelerators are powered by IBM BlueWorks Live, IBM Business Process Manager, IBM Operational Decision Manager, and in some cases, they're integrated with IBM Mobile First. We have a number of accelerators available for different industries, with more being created all the time. The efficiency of the healthcare industry could be improved significantly with better automation. By getting information to healthcare professionals when they need it, rather than having them search for information. Through contextual awareness, that is, providing professionals with a common set of actions that can be taken along with the information provided. And since there is a process behind each of these actions, the process should be automated where possible. We're not taking medical decisions away from healthcare professionals, but we should be improving how the IT capabilities enable the professionals to make decisions and carry them out. IBM has started working with healthcare organizations across the world to define and develop a broad set of smarter process solutions. In the emergency department, specialty consults can be automatically dispatched and routed to the appropriate provider. A patient's clinical information can be automatically processed using rules to help doctors diagnose medical conditions and define treatments. Rules can also be used to check prescribed drugs to avoid allergic reactions and drug interactions. Looking across the healthcare enterprise, IBM's Smarter Process Industry Accelerator will help organizations to increase patient access and throughput, to reduce wait times and length of stay, to improve clinical outcomes and reduce readmission rates, to manage the cost of care, to present a real-time view of clinical and non-clinical processes, to give real-time reporting on key performance indicators or service level agreements, and finally, to accelerate the speed with which IT can deliver solutions. Now let's talk about how IBM's accelerator for healthcare might be used. This diagram represents a set of high-level clinical use cases. A patient might come into the hospital through the emergency room with a problem. As an alternative, a doctor or medical group may recommend a hospital procedure or a stay as part of their consultation. In either case, the patient could be admitted to the hospital. Once admitted, the patient's doctor or MRP is going to define a care plan. The care plan may involve other specialties, including pharmacy, occupational therapy, and other specialties. All the specialties collaborate and coordinate their efforts in the care of the patient. Ultimately, the patient is discharged from the hospital to a skilled nursing facility or to home care. After the patient is discharged, the health of the patient may require monitoring. The patient may have doctor visits, and there may be a need for additional care coordination. IBM's Accelerator for Healthcare provides support for the emergency room consult, creation and execution of care plans, patient discharge, and post-discharge follow-up. Now let's look at the Healthcare Accelerator. IBM has modeled out a complete care management and discharge readiness process in BlueWorks Live. BlueWorks Live is IBM's software as a service, cloud-based wiki offering that is the most efficient way to engage line of business users to collaboratively do process discovery, modeling, documentation, and process automation. It enables the business to easily streamline, model, document, and run processes in the cloud. As you can see, this is quite a complex process. Let's take a look at just a piece of it. This is a small part of the process. As you can see, swim lanes define roles and the tasks and activities that are performed by the people in those roles. There's roles for the system itself, the liaison nurse, doctor, and allied health. Activities are linked together with arrows and decision gateways to form the process. The purpose of this process is to enable a care plan to be created and then to assign the task to providers. It gives the providers the ability to accept, delegate, or reject the activity. In another process, the providers collaborate in caring for the patient and ultimately in discharging the patient. This process can be modified in BlueWorks Live to meet individual hospital requirements. Then the process can be loaded into IBM Business Process Manager to complete implementation. This is IBM Process Designer. It's the development environment for Business Process Manager. After processes have been modeled in BlueWorks Live, they can be imported into Process Designer for completion of the implementation. As soon as a process is imported, it can be run, or as we call it, played back. With a lot of tools and methodologies, requirements are created and then they're handed off to IT. IT goes off and does their development, and business users don't see a solution until testing. But with Business Process Manager, business users and IT can play back the process as it's being built. We say the Business Process Manager supports an agile development cycle. Tighter collaboration between business users and IT improves the final solution. And much more of the implementation occurs using drag and drop or configuration. There's much less code to be developed. It's possible to run simulations to improve or optimize business processes. It's easy to set priorities or define schedules. And Business Process Manager comes with predefined key performance indicators that can be used to measure business performance during runtime. As an agile platform, Business Process Manager speeds delivery of the solution. User interface screens for a process can run on mobile devices, in custom applications, or in Java portals. But we're going to use the process portal that comes out of the box with Business Process Manager. Here you can see that BPM is keeping track of the work assigned to people. Several types of reports appear along the top, and on the right area, there are several processes that I can start. We'll do 3 short demonstrations of the Smarter Process Accelerator for healthcare. In the first demonstration, we're going to create an emergency department consult order. In the second demonstration, we'll create a care plan to be used by doctors, nurses, the pharmacist, and allied health workers to get the patient ready for medical discharge. The final demonstration shows how a care coordinator might work with a patient's care plan, with health providers, and with family members. Arnel Pineda is the lead singer with the rock band Journey. Back in 2012, Arnel suffered severe laryngitis that forced Journey to cancel a couple of concerts. We'll follow Arnel from the emergency room through a hospital stay and then to discharge. Let's look at a specialty consult from the emergency department. In many hospitals, the emergency department doctor will ask a clerk to page a specialist to come to the ED for a consult. The clerk contacts the call center asking for them to page the specialist on call. The call center, again manually, must figure out who to contact and then sends a page. Usually there's no information in the page. The doctor they page may or may not respond. He or she may be with the patient, or they may just head to the emergency department. If the doctor that was paged doesn't respond immediately, the emergency department doctor may ask the clerk to page the specialist again, or to page a different specialist. There's the potential that several specialists may eventually come to the ED, a significant waste of time and money. Let's look at what an automated consult might look like. I'm going to start a consult order request. The Smarter Process Accelerator for Healthcare has created a consult request. Now I'll fill it in and submit it in order to get a specialty consult. This form presents a roster of patients that are currently in the emergency department. I'm going to select Arnel and then fill in the consult request. The Smarter Process Accelerator for Healthcare knows that Arnel has laryngitis, and so it has selected the service automatically: eye, ear, nose, and throat. It's also looked up the doctor on call and discovered that it's Gregory House. It also shows the physician's contact information. All I need to do is to assign a triage code and then request the consult. After the consult's been submitted, BPM sends an SMS message to Dr. House. As you can see, there's much more information in this consult request than simply a number to call back. You have severity information, the name of the patient, the department that's requesting the consult, and the doctor that's been requesting the consult. When Dr. House did not respond immediately, the Smarter Process Accelerator sent a second notification. Notice that the Smarter Process Accelerator has created a consult review request. The consult review request would ordinarily be assigned to Dr. House, but for purposes of this demonstration, I've routed it back to me. Let's review the consult request. Notice that we don't even have to open it in order to see a lot of information. It's assigned to Gregory House. It's assigned to the service of eye, ear, nose, and throat, who the patient is, and their severity. Let's open the consult review request. The purpose for this review request is for Dr. House to be able to take an action. He might accept the consult request. He might delegate it to another person, or he might reject the consult request. But in this case, Dr. House wants to meet the lead singer of Journey, so he's going to accept the consult request. The Smarter Process Accelerator has queued another task for Dr. House to perform the consult and then ultimately to close the consult request out. The accelerator is communicating status between Dr. House and the emergency department, and it's orchestrating a set of activities to close out the consult request. Now let's assume that Arnel has been admitted for recuperation. His doctor needs to create a care plan that engages other specialists in caring for Arnel. We'll create a discharge readiness plan. This form shows a roster of patients. Each of them needs a care plan created. Let's select Arnell. The Smarter Process Accelerator has loaded a care plan or standardized care pathway for patients with laryngitis. By default, medicine and pharmacy are required activities. There are also a set of optional activities for occupational therapy, for physical therapy, and for social work. It's possible to include comments as the care plan is created. Arnell has been complaining of cramps in his hand. Let's order physical therapy. Now let's submit the care plan. We'll notify the different healthcare providers that a new patient's been assigned to them. In the care plan, there are required activities for medicine and for pharmacy. We also ordered up an activity for physical therapy. As you can see, the Smarter Process Accelerator for Healthcare has created activities for each of these specialties. In the process portal, you can also see a visual representation of the care plan and the status of all activities. As Arnell's condition improves, the hospital could assign a care coordinator to manage his discharge and to organize and monitor additional treatments that he might need. In this case, Arnell may not need significant follow-up, but many hospitals and insurers have begun to assign care coordinators when patients are suffering from COPD or other serious conditions. The care coordinator helps hospital specialists to work together efficiently to maintain the quality of care and to manage the length of stay. After the patient is discharged, the coordinator works with the external providers, skilled nursing facilities, and the family to monitor the patient's condition and to manage the risk of relapse or readmission. Let's look at how the work of the care coordinator could be enabled using the Smarter Process Accelerator for Healthcare. The care coordinator wants to review information about Arnell. In the middle at the top, you see basic patient information. Below you see Arnell's clinical information. Under clinical milestones, you see the status of the care plan. There are also administrative tasks and to-dos for the care coordinator. One task is to meet the family. The coordinator may need to verify information about family members and may need to choose a preferred skilled nursing facility that the patient is discharged to. Notice that after I've met the family, the administrative task has disappeared from my to-dos. There may be insurance documents that need to be filled out in order to make a claim. It may be desirable to communicate with different care members. For example, we could send a message. We could initiate a conference call. Perhaps we could initiate a WebEx. Notice that Arnell's brother can be a care team member and can participate in communications with other care team members. And finally, it's possible to create medical notes that go in the patient record. These demonstrations are just examples of how our Industry Accelerator for Healthcare can automate and improve care processes. A comment that we often hear is, "We have an EMR that does that." To this, IBM's response is, "Great." IBM is not suggesting that organizations replace their EMR or their other systems with process management. We are suggesting that organizations choreograph and improve the way healthcare professionals work with your existing systems. EMRs play a critical role in the delivery of healthcare, but we're entering a post-EMR world that demands more than just record keeping. Healthcare professionals need the ability to synthesize and share information from across the organization, as well as with external parties. In a post-EMR era, we need to be able to integrate clinical decision-making that's occurring from services on the web. EMRs are not going to be able to do this, so healthcare organizations need to look at other solutions. IBM's Smarter Process Industry Accelerator for Healthcare should be part of that solution. Thank you for your time.